The Health Minister told the Assembly today that an overwhelming majority of people here believe that our health service must change to deliver what it needs. The Minister was speaking following the publication of the Transforming Your Care report and other associated reports. Well, with me now, the Health Minister Edwin Poots. Very good evening to you, Minister. So how significant a change is this for the health service?
Well, I think that what we've been saying over this last year in Transforming Your Care has now been validated by the community themselves. So 97% of people believe that change is necessary, and we had close to 2,500 people responded. So this is a very significant consultation that has taken place and given us the authority to do the work that's proposed. You
want to see, and obviously large amount of detail in these reports, so picking just something, for example, GPs doing far more in the community. The big question, though, are the resources there?
Yes, well, we will transfer resources from the hospital sector to the GP sector. So, we will enable GPs to carry out this work. We recognise that there will be a greater workload, and that will be a challenge for GPs, but we need to ensure that, in conjunction with allied health professionals and specialist nurses, that we do have more care in the primary sector.
So does that mean more money for them?
That will mean more money going to that sector and that area, and that will enable GPs to employ the right people within their service to ensure that more services are carried out for the local community at a local GP facility.
There is a fear, though, among some of those family doctors that this is smoke and mirrors here. You're robbing Peter to pay Paul.
Well, we certainly are taking money off one sector and giving it to the other sector because we want to engage at that primary level to ensure people, particularly with chronic illnesses, don't end up with acute illnesses, thus requiring hospital intervention. Nobody needs hospital intervention if it can be avoided, and that's where we want to get to.
I just want to focus, Minister, if you would, in terms of residential care, of which a great deal of focus is being placed. Is shutting down residential care homes the answer?
Well, what the answer is providing the right domiciliary care to allow people to stay in their own homes as opposed to going to residential care. And that is the purpose of this. It isn't about shutting residential homes. It's about not needing residential homes because we offer people a better alternative.
There is a risk here, though, that as we head further down this route, it's going to lead to a lot more confusion, especially amongst the elderly community.
I think that we need to have the right packages available, and it's incumbent upon the Trust to ensure that those packages are individually based and the appropriate package for each individual to enable them to stay in their own home.
Very briefly, if you would, Minister, when will we see the big push to try and get these changes coming into effect?
Well, integrated care partnerships, we were hoping 9 or 10 of them will be established in the course of the next few months. And we are putting 479 new supported living packages into place, and that will ensure that elderly people can stay in their own homes.
OK, Health Minister Edwin Poots, thank you very much.